Today we are going to talk about cat vomiting with some emphasis on hairball control. But first we must understand what is vomiting, and what is another word called regurgitation, which is also used by doctors. Regurgitation usually occurs quickly and in a very gentle and passive way, so it may not attract much attention as usually happens with vomiting, is a situation that involves many parts of the body, so it will be a little more violent and more striking. So the owner is going to feel a little more overwhelmed watching his cat, and he is going to feel a little bit more nervous. The regurgitation in cats is not very frequent. It is more than all the vomiting. The vomiting can be presented in a different way because they can have consumed some substance that makes them vomit suddenly, or sometimes, and in the great majority, it can be presented by the hairball, and that is the hairball. Since we know that the normal behavior of our cats is the grooming, this makes them ingest the hair and it reaches their gastrointestinal tract. What happens there? Many times it can be expelled in the feces, but sometimes it can remain at the stomach level and produce an irritation. Sometimes it can generate something called trichophores, which are hairballs that do not come out or are not expelled and can generate an irritation. And they are not expelled and can generate an obstruction, and it is a little more complicated issue because it requires surgery also to generate some problems at the colon level as megacolon. And this also involves a fairly complex surgical issue and a recovery of this fairly common surgery. Well, the hairball, that is the accumulation of hairs at the gastric level, or sometimes it can be intestinal. Why this happens in the case of felines? We have a quite natural and normal behavior, which is the circulation. And even more if we have two cats at home, and even with one this can happen. And then we must make a more exhaustive control of the hairball. But what happens when there are two cats? How do they groom each other? That is to say, they groom each other. We are going to have a consumption of hair that is going to be lodged in the intestine. Hair that is going to lodge at the gastric level, and many times they cannot expel it in the feces. And what they do is vomit. Then it is seen in a violent way that they expel something through their mouth, and many owners report that it looks like a poppy chick, and it is the hairball, and many do not notice anything, but vomit the hairball and nothing happens. But this, as I was saying, is not normal. We must do it and start looking for the hairball. We must do it and start looking for the cause of this symptom, that is vomiting, because the primary cause may be the hairball, but there may also be other causes attached to the hairball, and may also present some symptoms at the intestinal level, as the megacolon, that requires a slightly more extensive surgery and a slightly more extensive recovery. What happens when we have a long-haired cat and we have to control the hairball? And we are going to start with the hairball. And what we can use for this control: there are jellies, there are also cookies, and everything hopefully should be recommended by the veterinarian, so that he can evaluate. But in general terms of the jellies, we should give approximately 1 phalanx more or less 2 or 3 times a week during the whole life, and sometimes we can space the intake of this jelly and the cookies. The cookies should have a series of components that help us with a high content of fiber, with some oils that help us with this gastrointestinal tract. that help us with this passage from the level of the gastrointestinal tract to the gastric level, and at the intestinal level so that they can be expelled in the feces, but it is never normal that our cat vomits. What happens also when we have two short-haired kittens, for example, as if you were a long-haired kitten, then for both of them we should also do the hairball control. When we have only one short-haired kitten, that we see that he grooms himself in a normal way, because he will also have an accumulation of hair, but it will not be as much as if we had two or one long-haired kitten or one semi-long-haired kitten. We should also do this hairball control if we can start more or less a year and a half or 2 years we can start to do it. There are also foods that contain some elements or nutrients that help us with the hairball control, and we should ask our trusted veterinarian, or where we buy the concentrate, and we should emphasize that it should be hairball control. Vomiting has different causes, and we have already talked about a very particular one, which is the hairball, right? Then we could also think about some of these diagnoses that could be extra-intestinal or outside the gastrointestinal tract, such as the kidney, the liver, the pancreas, or many times it can also be pain, or it can also be stress. So for this we must always keep in mind that our trusted veterinarian, or you veterinarians, must have a protocol to attend the patient with vomiting, and we must first take into account if we receive our patient with vomiting, if this is acute or has already been several episodes of vomiting intermittent, to see what will be our course of action. But first we must maintain the welfare of our patient, and in this case we can first use suddenly some antiemetic to generate welfare, and then we start with the diagnostic issue that the best thing would always be to take a complete pool of blood biochemistry, including urine, and if possible also perform some kind of ultrasound. For the diagnosis of a cat with vomiting we must have a protocol, always thinking about our patient. We will have to take a complete pool of tests, including complete biochemicals, renal profile, liver profile, pancreatic profile. We must also include the urine. The urine test is quite important and conclusive in cats, and we must also think about diagnostic images such as ultrasounds. That would be the basics that we could say start with our patient. But here also arises a question: many of my patients that I cannot perform emergencies at home. They are referred to the clinics, and in the clinics the first thing they do is to hospitalize the patient. And the patient may be quite well, let's say, in his normal behavior. And in the hospitalization it is going to be that this stresses, and in a quite abrupt way, the patient. The diagnosis may not be so definitive. So we have to take into account and always think about the well-being of our patient, and be able to manage some episodes of vomiting at home with injections at home, and that will help us. But we must also think if we have a patient who is, let us say, stable, and if we have a patient who is not stable. Always when our patient who is not stable already has several episodes of vomiting, we must consider him as a non-stable patient and carry out a more profound diagnostic protocol with more profound diagnostic protocols such as ultrasound, endoscopy, and take biopsies to see if we have some mediated gastritis that are generating our beautiful chronic processes. Also, The issue of doing laparoscopy or laparotomy could also help to see if we have some partial obstructions that we are observing neither at a geographic level nor at a radiological level. But we must always keep in mind that vomiting is not something natural, and it is not something normal that happens in feline patients, and we must always reach a diagnosis a little bit deeper for the owners who have cats that vomit. Constantly, it is important that you have this quite clear and begin to observe the dynamics of feeding your cat, and before your cat gets bad and has another episode of vomiting, resort to the veterinarian to perform the relevant diagnostic protocols. Until then guys, see you in the next chapter. Remember to follow me on my social networks, Dr. Cat on Facebook and Dr. Cat on Instagram. See you later.